Hello, my name is Erica. I'm a student at Excelsior University. My current course is Nursing 104, and my professor is Dr. Wafer. Today, I've been assigned a patient named Willie Footman. His date of birth is 3/4/1975, and the patient is here for a head-to-toe assessment, and I've already collected my patient's consent. I'm going to go ahead and enter the patient's room. Hi, Mr. Footman. Can I come in?
Yes.
Okay. Hi. I'm just gonna draw the curtain and provide privacy. I'm going to perform my hand hygiene. Mr. Footman, my name is Erica. I'm your nurse today. I'm going to be performing your head to toe assessment.
Yes.
Is that what you're here for today?
Yes, full body.
Okay, full body. Okay, awesome. Mr. Footman, once again, can you tell me your name?
Yes, Willie Footman.
Okay, can you tell me your birthday?
Yeah, 3/4/1975.
Can you tell me today's date?
4/6/2025.
Okay, and can you tell me who the president is?
Yes, Donald Trump.
Okay, and the reason for your visit today?
To get a full body assessment.
Okay, so I've collected consent and I've confirmed that the patient is aware of who he is, where he is, the time, and the situation. The patient is alert and orientated, times 4. So now, Mr. Footman, I'm going to be checking your head and your neck, okay? I'm going to grab my pen light here. Okay, so the patient, can you sit up straight for me? The patient head and neck is symmetrical. The patient ears are symmetrical. The patient eyes is symmetrical. So now I'm going to be checking the patient's oral cavities. Mr. Footman, can you say ah? Patient has all 32, and it seems he's wearing some covers over his teeth. Mr. Footman, what are those over your teeth?
Retainers.
Retainers?
Retainers.
So this is, you've already straightened your teeth?
Straighten. I'm sorry, straightening.
Okay, so is it like an Invisalign?
Invisalign.
Okay, the patient is currently wearing Invisalign. The mucous membrane is pink. The tongue is pink and moist. The patient oral cavity is moist. His lips are, patient lips are moist. And now I'm going to assess the patient's eyes. Mr. Footman, I'm going to be checking your eyes, but I'm going to cover it to make it dark and introduce some light. Okay, is that okay?
Yes.
Okay, do you have any stigmas or anything like that? Okay, good. Okay, so I'm going to cover this eye. I'm going to start from the chin and introduce the light. Look at me, please. Okay, I'm going to cover this eye and introduce the light. Okay. Patients pupils are equal, responsive, round. So patient pupils are round, equal, and responsive to light. Okay, so head and neck symmetrical. I don't see any abnormal findings on the patient head or the neck. So now I'm going to check the patient's extremities, and I can visualize that the patient has good muscle tone. Okay, so now I'm going to check for the temperature. Patient's skin is warm and dry. Now I'm going to check for the patient capillary refills. Capillary refill on the right, less than 3 seconds. Capillary refill on the left, less than 3 seconds. I'm going to check the patient's distal radial pulse. Okay. Okay, patient pulse is strong and equal. Now I'm going to check for your grip. Can you squeeze my hand?
Yes.
Squeeze, squeeze, squeeze. Okay, good. And now we're going to check for range of motion. So can you raise your arms like you're lifting weights? Okay, just like me. Is this the arm that's bothering you?
That's right.
Okay. Can you stretch your arms out straight like me? And can you bring it back? Okay, awesome. Now we're going to check your wrist. Just like drop your wrist. Okay, awesome. Now I'm going to check sense for sensation in hand. So can you close your eyes and raise both your hands? Okay, I'm going to touch your finger and you tell me which it is, okay? Which hand is that? Which finger?
Right pinky.
Okay.
I'm sorry, right, left. Right hand, pinky.
Okay. Which hand? Which finger?
Left hand, pointer.
Okay. Okay, good. So the patient has sensation in the left or right. So I've completed the patient neurals check. I completed the patient head and neck. His eyes and ears, or I've checked for symmetry. I've checked his pupils were equal, round, and responsive to light. I've verbalized that. I've checked the patient's lips, mouth, tongue, and teeth, and color. I've also checked for the patient's upper extremities. He has good muscle tone. I've checked for temperature. The patient's skin was warm and dry. I've checked for strength. The patient has strength is equal. I've checked for grip. I've checked for capillary refills, and I've checked the patient's apical. I've checked the patient's bilateral. I'm sorry, apical pulse, which was strong and equal. So now I'm going to, Mr. Putman, are you okay with removing your shirt?
Yes.
I'll take this for you. Just going to perform some hand hygiene. Okay, so first, with the patient's abdominal area, I'm going to inspect. I can see that the patient's shoulders and the chest are symmetrical. I don't see any abnormal findings. I'm going to check for skin turgor. Patient skin turgor is good. Now I'm going to assess for the patient's PMI, and I can locate that at the fifth intercostal space, mid clavicle. Keep your head up, please. I've located the patient's location for the PMI. I am going to check for the rhythm and the rate using my second hand on my watch. I'm sorry, I'm just going to go on this side. Okay, that concludes the PMI check. The patient's PMI pulse is 78 beats per minute, and the heart sounds have normal rhythm. Now I'm going to check for the patient's anterior and posterior lung sounds in 6 locations, front and back. You good? Take a deep breath. Okay. Okay. Patient lung sounds heard anteriorly clear. I'm going to check posterior. If you can raise your leg here. If you can raise your legs, yes. I'm going to check in 6 locations. I'm going to check the lung sounds posterior in 6 locations. There are 3 lobes on the right and 2 lobes on the left. In. Take a deep breath. Posterior lung sounds heard in 6 locations. Okay. So now, Mr. Footman, I'm going to ask you to lay back. I just want to make sure that I did this, but I'm just going to assess the patient skin turgor, and it returned right away. Okay, I'm going to put your hands to the side. So we have completed the patient's neural check. We've completed the head and neck. We checked the lip, mouth, tongue, teeth, mucous membrane. We assessed the upper extremities. It was patient has good muscle tone. We've checked the range of motion. We've checked range of motion. We've checked the hand grip. We've checked the capillary refills. We've checked we did the pulse, the apical pulse. Okay, good. And we've checked the patient's skin turgor. We've also checked for the PMI, and we've checked the anterior and posterior lungs. The anterior lung sounds were heard. Posterior lungs sounds were heard. Now we're going to start with the patient's abdominal. And first, we're just going to look, and the patient's shoulders and chest are symmetrical. The patient's abdominal area is flat. Patient abdominal is flat. So now we're going to listen to the bowel sounds. Mr. Footman, I just want to ask you, are you experiencing any pain?
Yes.
In your belly? Are you experiencing any pain in your belly? Okay. Bowel sounds heard in all 4 quadrants. Now I'm going to assess the belly. The patient already verbalized he's not experiencing any pain, but I'm still going to feel now. So I've already inspected, I've already auscultated, and now I'm palpating. I don't feel anything abnormal in the patient's abdominal area. So for the abdominal area, all bowel signs were heard in all 4 quadrants. Okay, so now we're going to assess the patient's lower extremities. Just gonna get my Q-tip. Okay. So Mr. Footman, once again, Mr. Footman, yes. I'm going to ask you to raise one leg. Raise it straight up. Raise the leg straight up. Okay. And can you bend now? Bend the knee. Yes. Can you raise this leg straight up? And now can you bend it at the knee? Okay. You can drop it. Okay. So I'm feeling for the patient's temperature. The skin is warm and dry to touch. As I'm going down the leg, I don't see any signs of edema. So the patient completed range of motion at the hip, the knees. We're going to complete range of motion at the lower. Mr. Footman, can you flex your foot, push on the gas? Now let me go against you. Let me go against you. Mr. Footman, yeah. Can you take both foot and just flex both? Just the foot. Can you raise this one and just flex the foot? Okay, good. Okay, thank you. So now I'm going to check for capillary refill. Capillary refill less than 3 seconds on the right. Capillary refill less than 3 seconds on the left. And now I'm going to check for the patient's pedal pulse. pulse on left and right equal and strong. Now I'm going to check for sensation using the Q-tip. Mr. Footman, can you tell me where you feel the Q-tip?
Yes, right on big toe.
Can you tell me where you feel the Q-tip?
Left pinky toe.
So the patient has verbalized he feels a sensation on the left pinky and the right great toe. So I'm going to dispose this in the proper receptacle. Okay, so I just want to double check that I did everything. We've completed, we've checked the legs. There's no signs of edema. We did the range of motion at the hip, the knee, and the feet on the left and the right. We've checked we did the pedal pulse. We've checked sensation, and we also checked for circulation. So that is for the lower extremities. We assess for edema. There's no edema, no findings. Range of motion, we've done that. Just to do this one more time, Mr. Footman, can you just bring your foot in and then push it out? Okay. Bring it in and push it out. Okay, good. All right. So now I'm gonna help you sit up. Mr. Footman, you can sit up. Okay, awesome. Okay, so just to address, you said you had some limitations. Yeah, so there was abnormal findings on the patient right shoulder. He does have some limitations, and which we need to I'll provide him a slip for the specialist on the outside after discharge, and he has limitations there, and the patient is also wearing orthodontist. He's currently under orthodontal treatment. He's wearing Invisalign. And Mr. Footman, please make sure that you keep up with your appointments. Okay. All right. So now I'm going to perform some hand hygiene here. Mr. Footman, do you have any questions for me?
No.
Do you have any questions for me? Is there anything like you're concerned about? Any environmental things? Any medication?
No, it's my shoulder.
Is there anything else any questions that you have for me? Sunblock.
Oh, sunblock. Yes. My wife had asked me about sunblock. I want to know which percentage should I use?
Okay, so with sunblock, does she already always stress you about using the sunblock?
Yes.
Okay, so with sunblock, it is deeply recommended from your doctor, dermatologist definitely recommends sunblock, as we can't block the sun 100%. Right. It is recommended that you use at least 15% and above. You'll notice when you go into like a pharmacy or any store where you can buy it, that it'll like have 15, 25, 35, 45. Even though that it does go a little bit higher, but nothing blocks the sun 100%. But it does prevent some of those rays from reaching you, and those rays can cause skin damage and possibly cancer. So yes, sunblock is something very important that we all should be using. And the best time to use it is during the day. So if you're out and about early in the day and those rays are at their highest between 11 and 4 p.m., you definitely want to protect you're supposed to be protecting your skin during those hours. Okay? Do you understand when should you be wearing the sunblock?
Yes.
When? Around what times?
In the daytime.
During the daytime, around what time should you make sure you have it on?
Well, from 12 to 3.
Okay, between 12 and 4 is like that's when the rays are like the highest. Okay, so and then just remember, you'll never find anything that's 100% will cover you, but you will definitely start with anything that is 15% and greater. Okay, and as far as your assessment, everything went good. You know what you have to follow up with.
Yes.
Okay, so I have cleaned my stethoscope and I put it in the clean field. I'm going to clean my pen light. Okay, Mr. Footman. If there's no other questions, I put my pen light, I've cleaned it.